Hi, good evening. My name is Dominique Newkirk, and I'm a student studying behavioral health technician. Today, I will go over what a behavior technician is, along with the roles of a behavior technician, along with job placement and also education that you can further if you decide to. A behavior technician serves as a health professional of some sort. Basically, a person that can deal with a range age group from children to adults to support and monitor treatment plans that's given to help one's uh, to monitor, I'm sorry, individuals' behavior. Okay, so what education is needed to be a health technician? A high school diploma is needed. 40 to 90 hours of approved training along with any coursework. What is a behavior technician? Um, I'm sorry, what roles does a behavior health technician has? A behavior technician is someone who assists an individual with daily activities that could be in school, that can be for an adult at home, maintaining daily duties, washing or being sure that they're consistent with doing their laundry, making meals, basically, monitoring behaviors. Um, if there is an action plan or support plan that's given, we want to try to maintain that, support those goals that's written out by a health professional, by a psychiatrist, a counselor, or, even maybe drug rehabilitation. Sometimes there are support plans that's given that has to be followed, and you want to continuously observe because things can always change. As we, for an example, Aiden, it looks like he's at a library and he has a behavior health technician with him. So, Mr. Gary is there to maintain the action plan that's given. Let's make sure Aiden is doing his work within a 5 minute time frame. Give him breaks throughout his work. So we're there to guide, not to continuously, this is what you need to do. No, we're there to actually support and verify the behaviors. This is something that we will have to document. To observe is very, very important. The modalities, the symptoms, reactions to certain things. We have to be clear and precise when we're documenting these things because this is a history for that person. This is something that will always be with them, if they need these certain support groups. So we want to maintain the ability to recognize certain things. Um, for education, you can also further your education as a registered behavior technician, that you can do a 40-hour training. You will have to pass a competency assessment test along with the behavior analyst certification board exam, which I'm actually thinking about doing. Um, or also, if you're considering a behavior health technician, you can sign up for District 1199C, the free program for a behavior health technician that is instructed by Dr. Ty, who is absolutely phenomenal. You're going to get mastery information that's not given out anywhere. It's not just a answer book. No, you will have definitions. You would have examples. You will follow different protocols. You will learn a lot. So, basically, um, a behavior health technician will support an individual to just focus on their behaviors and how we can support them. Um, it's more to it that probably is more detail if you decide to further your education. But this is mainly what that person is, just a support system. It's a support system from the doctors on down, doctors, psychiatrists, counselors, and that support person that holds up the foundation, that maintains the foundation for everybody else to flow in line. So it's a very critical and important role, just because, you know, it could be at the bottom of some sort. This is a very important role, and that keeps everybody else in order and what they need to do. So, once again, my name is Dominique Newkirk. I'm a student, a behavioral health technician student. I thank you for watching and have a great evening.